Hello, today I will expose one of my clinical cases about melancholical psychosis. Description: a patient, a man, let's call him David, in his 40s, a widower, started drinking heavily after the death of his wife. We began working at the psychiatric hospital and continued after his discharge in private practice. The psychiatrists had difficulties in diagnosing him, and they were constantly hesitating between the diagnosis of paranoid syndrome or bipolar disorder, constantly changing the medication. Reason for hospitalization: he was trying to suicide in a state of heavy alcoholic intoxication in the park when a passerby saw him and called an ambulance. Symptoms: inner emptiness, no desire of living, suicidal thoughts, mood swings, psychomotor agitation, retardation, and excessive feeling of guilt. Anamnesis: his grandfather and uncle committed suicide, no running psychic disease in the family. Self-awareness: before he thought he was normal, but now he started understanding that he was in need of psychological help. He had lost everything: apartment, job, his parents, and wife. This everything happened simultaneously during a period of 6 months. He had no place to go. He had fear of the future. He said, a quote, "It's difficult to be a man, to carry everything on my shoulders. I cannot accept myself the way I am. My brain lives two separate lives. I have impression that I am divided into two parts." He was constantly talking about his two, even three parts in all detail. He was saying that he's unique in the whole universe. He was saying that he was fighting for his personality. He claimed that nobody was able to tell him anything new, but probably to teach, yes. He affirmed that having no goal in life and simply existing means killing oneself. He was fantasizing about the scene of his widow, who would be crying bitterly at his grave. He was very sensitive to the memorial dates, for example, the anniversary of his wife or their wedding day. At that days he was experiencing drunken blackout. He wanted to kill the past. He was claiming that God didn't exist, even though he was regularly going to the church and citing Bible literally by heart. He posed a question: where do those thoughts come from? Everything is fine with me, however, suicidal thoughts keep on coming. He wished that somebody would have showed him a way out, that somebody would have understood that he is in need of help, and somebody would have saved him. He wanted to change his name and his surname, which would cut him off his family and therefore his origins. Request consisted in helping him to overcome the suicidal thoughts, and he wanted also to learn how to manage anger and get rid of loneliness. About family: his parents were rich and constantly busy with their career. They were giving him money, however, were not given their time nor love, which he wanted so much as a kid. It turned out that his parents knew about the fact that he was not attending school for 1 year upon notification about his expulsion from school. He says he didn't consider his parents as his family. He has been living alone and gaining his living since he was 16 years old. When David was a little boy, parents used to tell him that they didn't want him and that they were tired of him. About the other: when a partner doesn't respond to his feelings, he feels pain. About transfer, he asserted that he was talking to me like he used to talk to his mom. He confessed that he started trusting me when I gave interpretation about his inner conflict. When I was on vacations for 1 month, he was coming daily to the walls of the hospital, heavily drunken, and was expecting my arrival. When I returned, he was insisting on increasing the number of analytical hours. He said that he liked working with me because, in his own words, a quote, "You care for me, you won't disappear anywhere, you will always be near. When I talk to you, the truth about myself reappears." The analyst occupied a place of his lack, the inner emptiness, which alternately was filled in with his mom or wife, both are dead, or alcohol. About dreams. He was either bringing lots of dreams to the sessions or no dream at all. Here's one of his dreams. At the wedding, he sees the funeral wreath. The same dream repeats several times during several nights. His other dreams revealed the unconscious desires turned into their opposite in reality. For example, he was seeing himself kissing a person he hates. Clinical picture. His symptomatology, in particular his relation to the object, gives me grounds to affirm that here we deal with melancholical psychosis with the elements of mania, which was triggered off following the emotionally burdensome events. This is not neurotic depression. Depression belongs to the clinic of neurosis, and melancholy refers to the clinic of psychosis. The relation to the object, the lack, the privation is different in depression and melancholy, which appears for a child in a form of maternal castration, evidently imaginary. In depression, a subject has lost his object and cannot recover it. In melancholy, the object cannot be lost because it has never been structured as such. A depressed subject holds on to his leg so that to live, to breathe. For a melancholic, the leg is in the other, the object A is not lost, he still uses it, he carries it in his pocket. About analytical work. It's difficult to summarize the work, which lasted over 2.5 years with intervals, and which definitely didn't impede David from consuming alcohol. However, it helped him not to be hospitalized again and allowed him to lead almost normal life, as he says. From a psychiatric hospital suicidal patient, he turned into an active person with variable periods of work, family, and recreation. Of course, these periods were interchanging with very short moments when he was drinking and isolating himself. However, at this time, not abandoned somewhere on the streets, but at his apartment with his family. During his analytical work, David managed to reconstruct his history and become aware of his guilt, which was provoking the suicidal thoughts and was hiding at the bottom of very reactional melancholy from which he suffered after the death of his wife, the guilt which he was carrying inside for not being able to save her life. His spectacular drunken blackouts weren't the sign of psychotic craziness, but that of depression, which was followed by trauma, which was the death of his wife. The relation of David to what we refer in psychoanalysis as the name of the father was not disrupted. There was no foreclusion of the name of the father, no disintegration of drives. The difficult reality wasn't projected by his psychism outside. As Freud pointed out, it is the social reality which was organized in a scaring, nightmarish way. Of course, the death of his wife wasn't the proof of any psychosis. However, the diagnostics, which is based on several exterior signs, cannot but bring about the dead ends and catastrophes. The ancient trauma, death of his mother, and even more ancient, his childhood, have been accumulated during this recent event, death of his wife, which he considered as a personal failure. The inadmissible failure which demands that a man occupies a certain place and finds resources to cope with anything. The psychiatrists were rarely talking to him, and when they did so, it was often done with condescendence, contempt, and arrogance. The truth was on their side. David has become an object, a simple thing, a little bit weird and disobedient, non-compliant patient to whom the severe medication should have been administered so that to make him shut up. The primary cure always remains the listening in the way which considers the patients as subjects, no matter what disorders they suffer from. This patient was crushing everything when medical personnel at the hospital was ordering him in a severe and commanding manner to make his bed. Don't these frequent reactions to the unnecessary authoritative positions prove that there is too much of authoritative father? A father with his brutal power, a father who decides to make law, a patriarchal father who doesn't recognize his feminine part, could be a source of certain paranoia and psychosis, as Freud shows to us. Also, an interesting aspect evolves around his family name, which he wanted to get rid of at any cost. Gérard Pommier contributes to the better comprehension of the differentiation of psychoses by distinguishing them accordingly to the relation which a subject adapts with his surname. A name was given and taken. A name was not given, however, was taken. A name was given and was not taken. In David's case, a name was given but not taken. What helped? First of all, structuring his thoughts in a diary, which are recommended to fill in every time the suicidal thoughts were obsessing him. Secondly, planning his day, morning exercise, breakfast, medication, work, seeing psychologist, a walk, dinner, sleep, etc. Thirdly, designing his new life. He had a detailed project about how his new life would look like with his new partner. He also created his new name, which looked like a modified name of his dead wife, which is incorporation of a wife. Changes which happened during the analysis. He started saying what he really thinks without inhibiting it. It is really a big step forward, considering that earlier he was inhibiting it, which was leading to the to aggression and violence, oftentimes directed against oneself. He claimed that his conscience was changing. A quote: "I don't know what helps in work with you, but somehow it definitely helps."